when I was in Ward 20, I just felt normal. There was no pain or anything. I'd been in hospital before with various injuries through a road accident, and I felt comfortable because I'd had the experience of being in hospital before. I had no fear whatsoever in Ward 20 because I knew what the routine of the nurses.
And what did you feel like when they came to you and said you can go home now?
I was nonplussed really because they didn't put me up nor down really. I was a bit disappointed, I think, in leaving the hospital because I felt secure there, and I wasn't sure how secure I'd be when I was at home because I was there when there's always medical assistance there in the hospital on hand, done up quickly. And it wouldn't be the same when I was at home.
Did you have your ICD fitted in the hospital before you left?
No, that was a year later.
So you went home without?
It was a year later, and when I got it fitted, it was just supposed to be a one-night stay, and I ended up in for 13 days because my appendix burst through the night.
We'll come back to that.
Yes.
Come back to, but I think the fact that you came back for the ICD is important, so we'll maybe, because I think people go home with ICDs feel very safe, and then if you don't have one, perhaps it's...
Well, I had approximately a year before I had that ICD fitted, and I didn't feel any difference.
Did you worry when you went home at first? Did you worry about your heart? Did you worry about...
I can't remember worrying. I know when I did anything I had to watch what I was doing in case I did too much because I got tired pretty quick. Like, the more I did, the easier it was. It lasted longer without getting tired.
But you didn't have any cardiac rehabilitation formally, did you? You weren't offered that?
No, the local GPs was very good and kept a close eye on me for the first 2-3 months.
You had a district nurse that came in and saw you quite often.
Aye.
Quite often, didn't you? Though.
Aye, but I had to go every so often to the medical centre in Huntley again for a check-up with the nurses there, and that was about it.
And what did it feel like for you, Katie?
I'll never forget actually the day after he came home. We came home first of all via his father actually. That was the first bit of celebrations because Dad thought he would never see his son walk through the back door again. But then the following day, Keith and I walked up to get ourselves a newspaper in the morning, and he's very, very friendly with two men from work, and I have never seen such broad smiles on these two men's faces because they never thought they would see Keith back in Huntley again.
Lovely.
It really was.
I mean, when you at home with Keith, had anything changed with the way you
Absolutely no. We just carried on life just like what it was before, as if nothing had happened. I mean, what was the point? There was no point. Pussyfooting when I went back to work as usual. I knew there was an old lady. Well, she's not that old, but she was a lady that lived next door who was at home the whole time. So she came. She used to pop in whilst I was at work just to see if Keith was alright. But otherwise, Keith was just left to his own devices, and Keith just got on with life as normally as he could.
So we talked about sort of driving and things, Keith, because your work involved driving.
Aye.
Prior to the...
To a certain extent, just I got fed up walking back and forth to the shops with the unlimited amount I could carry, and I asked the GP if I could get my licence back. Then I got it back after 4 weeks, so which pleased me, so I could do a bigger shop.
When did you actually go back to work? How long were you off work?
About 6 months you were off work.
5 months in total, but I would have been back to work a lot quicker if the employers hadn't forced me to go up into their doctors, because I'd been off for such a long time. I ended up being off for 5 months instead of 2, The doctor signed me back for a phase return after over 6 weeks.
Okay, so you went back a couple of days at a time.
Aye, but I'd been back sooner. If I hadn't been off for 5 months. It was actually near enough 6 months with the phase return afterwards.
So tell me about the ICD then. Why did they suddenly decide after a year to give you an ICD?
Well, I was going in get checks up every so often, and they said that if you get an ICD fitted, if it happens again, that'll automatically kick in and put your heart back into rhythm. That'll give you enough time for the ambulance to get to you. And that was it. I said, okay, on you go.
But they didn't say why they'd waited a year to do that?
Well, I get the impression I got, they're monitoring me over the year. I had to go in about every couple of months to get checked up, and I think they were monitoring it to see how it went on. And finally decided, right, okay, go in with the ICD.
And does it make you feel safer? Or do you just...
Doesn't
bother you?
And I get an odd ache now and again for where it was in, but that's just normal wounds.
Is that a subcutaneous one, or is that you can feel it? No.
It's on the surface, just under the skin.
Yeah. So it hasn't affected you at all?
No.
No, that's good. That's good. But it's never kicked in?
No, unless it was my sleep.
I think you might move. The other thing I want to speak about, I mean, you've come through this relatively, I hate to say it, but unscathed.
Yes.
I think you've been incredibly strong about the way you've dealt with the whole thing, but you've also both now gone on to do something afterwards. Could you tell us about that? What you've...
Well, Katie saw a thing for Sandpiper Trust locally. Was the poster, was it?
It was in the local paper at one of the clubs that I belong to. The Sandpiper Trust had come to give us a talk, and the Sandpiper Trust was set up on the back of the death of a young child out in Canada, and they were in a fairly rural part of Canada visiting relatives, and the poor child drowned, but he was pulled out of the water, but there wasn't any emergency services close by, and if there had been, the child would have been saved. So on the back of that, the aunt came back and set up this thing called the Sandpiper Trust to look at rolling out emergency responses in rural areas in Scotland. Aberdeenshire has been the first area she's targeted. On the back of the Sandpiper Trust per se, they have now rolled out this thing called the Wildcat Project, whereby local professionals and lay people like ourselves are being trained to work as cardiac responders. So therefore, we can now go out and carry out CPR on individuals, if the necessary, as and when necessary. So we are now sitting at home with an awful lot of equipment in our house, because we actually do have a cardiac defibrillator sitting in the house, along with a whole rucksack of bits and bobs, so we can be called out at any time.
Yeah. And when I was up, Keith, you were talking about how you were a wee bit concerned about what it was going to be like giving CPR, knowing that you yourself had been...
We find it strange. I haven't had a call out yet, but I find it strange being at the other side of the fence. Experience it would be probably very nervous doing the first attempt, but I was told in the training we got, I was told that is normal, especially after what I've gone through. And you get, after that being a call out, you get a debrief, and certain new equipment that you've used replaced, like pads, tubing to keep the airways open, that sort of thing. A lot of people would think, if you see that the yellow jacket ambulance service on the sleeve, your normal first aider, but they're just cardiac arrest responders.
Yeah, well, I'm sure it will be quite strange the first time you do it. Did you think it would, I mean, you obviously felt it was important to give something back to the community based
Definitely,
on your
yes.
own experiences.
Yeah, that's one of the reasons why we agreed to come down and do this today, because I think it is so important that people who have either like Keith who have gone through the awful procedure. Yes, it is horrid for them, but I think it's even worse for the actual family and the spouses, because the likes of Keith, he's lying there. You know he's being well looked after. He's got this medical staff, medical teams running round about him. But sometimes the poor relatives, well, they're not left in the dark, but it is difficult for them because they can see exactly what's going on and is he going to come pull through and I mean, I didn't sleep for the whole 3 weeks. Keith was in hospital properly because I wasn't, wondering whether he was going to come back, and so yes, whilst it's awful for the actual victim, if you like, I think it's even worse for the victim. But all I can say is if you get the medical staff to support you and you get the help round about you, it isn't a horrid process. You can get through it. But you just have to, I suppose, like any local health board, whether you've got the staff there or not, to sort of rally around the relatives as well as the actual patient.
I believe, Keith, you're now a star in your own right in your local community. Am I right?
Well, the Sandpiper Gut Trust have used me as living proof to try and get people to become cardiac responders. Okay, that's fair enough to be if it gets the punters to help.
Because you didn't actually tell anybody in your class that you had had a cardiac arrest.
No, the initial standoff, the meeting we went to, one of the project managers, one of the paramedics that came to my emergency, and the other one was on duty with the ambulance, she came in as well, and it was the first time both of them saw me after the thing. They didn't realise who I was until it was mentioned that I was a cardiac survivor.
Did they know beforehand that you had survived, or had they just the last day?
Yes, no, they didn't know. The
know.
reason they knew that because the colleague who Keith who he works with, he was working as an ambulance technician at the time. I mean, what's so ironic actually, 5 minutes later, if Keith had his cardiac arrest, it would have been Keith's colleague who would have come and picked him up. So it was so ironic. No, but he did tell the girls that.
Oh, so they knew.
Yeah, so they didn't know. But they said that they had never met anybody who they had saved before.
That must have been nice for them, actually.
It was actually.
Must have been quite nice for you to meet the paramedics.
Well, it was. They got both of them got big hugs from me.
Big boozy.
And they were virtually near in tears at 2 quines.